Okay, let's dive in. Today we're taking a deep dive into AI for patient triage, specifically focusing on how this tech can help guide you, the patient, to the right care based on symptoms,
Yeah.
right when you arrive.
Yeah, that initial contact point. It's so critical.
Exactly. It's that first step, especially in busy OPDs and EDs.
Yeah.
So our mission today is really to understand AI's role here by unpacking the sources you've shared.
Right. And I think it's worth stressing just how vital that triage step is. I mean, it's all about quickly assessing who needs help most urgently.
That critical sorting process.
Yeah.
But the sources you pulled together show it's not straightforward, is it?
Yeah.
Even for experienced staff.
No, absolutely not. The material really highlights a few key pressures. You've got triage nurses, especially in busy departments, often just overwhelmed.
Yeah, I can imagine.
And then there's the fact that the process itself can be pretty subjective. It often boils down to that specific nurse's experience and judgment call in the moment. And that subjectivity, well, the sources point out it can lead to inconsistencies. Different patients might get prioritized differently, potentially causing delays.
And delays in an ED setting. That could be serious.
Potentially, yes. Especially during peak times, it could impact patient outcomes. And besides all that, the traditional way, the manual process, it just takes time.
So, okay, that paints the picture of the challenge. Where does AI come in then? How do these systems try to, tackle those specific problems?
Well, the basic idea from the sources is using AI to make that initial assessment more efficient and also more objective.
Right.
They describe systems, often using things like AI-powered chatbots or maybe kiosks that patients interact with right when they arrive.
So instead of talking to a person first.
Sometimes, yes. Or alongside. You'd answer specific questions about, say, your symptoms, your medical history.
Okay.
And the AI uses tech like natural language processing, basically, understanding what you've typed or said, and machine learning algorithms.
The systems that learn from data.
Exactly, to analyze your answers.
Right.
And based on that, it assesses how severe your condition might be and suggests the best next step.
Okay, so it's like an intelligent intake form almost. Gathering that initial info. Can you maybe walk us through what that actually looks like, on the ground based on the examples?
Sure. So imagine arriving at an OPD or maybe the ED. Instead of immediately waiting for a nurse, you might use a tablet or maybe an app on your phone. The AI asks you questions like, what are your symptoms? When did they start? Maybe, have you had this before?
Standard questions, but automated.
Right. But it's quickly comparing your answers against this huge database of medical knowledge to sort of figure out the potential urgency.
Okay.
And the sources also mention it being used in emergency situations, like paramedics out in the field.
Oh, interesting. Before even reaching the hospital.
Yeah. They might have handheld devices. They input vital signs, symptoms, maybe how an injury happened.
Right.
And the AI processes that data instantly, giving them maybe a risk score or a triage recommendation right there.
Wow. Okay. That immediate feedback seems like a big change. So, the AI does its assessment. Then what? What happens next for the patient?
So that assessment helps decide the next step. If your symptoms seem non-critical based on the AI's analysis, it might guide you to the right waiting area, or perhaps even suggest some self-care options if that's appropriate, just based on the info given.
Okay, so it routes you.
Exactly. And this is key in the sources, if the AI flags symptoms that suggest something serious,
Yeah.
it sends an immediate alert, straight to the human triage nurse or the right staff member.
So it bypasses the standard queue for urgent cases.
Precisely. It allows the medical team to quickly focus on those patients who are potentially most at risk, making sure they get seen fast.
That sounds, incredibly useful. The benefits seem pretty clear just from that. What specific impacts did the sources mention? Like tangible results?
They definitely highlighted several key benefits. First, it can really take some of the load off the triage nurses for that initial assessment part.
Frees them up for the complex cases.
Exactly, allowing them to focus where their expertise is most needed. Second, because it's algorithmic, it means every patient gets assessed consistently, objectively. That reduces the risk of errors, variability, which improves safety.
Makes sense.
Speed is another big one. Automating that initial step cuts down delays, potentially meaning treatment can start sooner.
Right.
And that all leads to just more efficient use of resources overall. There was actually a specific stat mentioned.
Oh, yeah.
Yeah, the material said these AI systems can cut the average time for that initial assessment by about 30% and improve the accuracy of triage decisions, too.
30% reduction in time and better accuracy. That's huge. In a busy ER, That's not just efficiency. That could genuinely save lives or improve outcomes significantly.
It's a substantial potential impact, yes.
Okay, but let's talk about actually doing this, putting these systems in place. The sources mentioned challenges, right?
Yeah.
Especially thinking about, say, diverse places like India. What kind of hurdles pop up?
Yeah, implementation is definitely not trivial. The sources brought up some really important points there. For instance, you need really good voice recognition, an NLP, that works across many different languages and dialects. That's a big hurdle in linguistically diverse areas.
Sure, absolutely.
Then there's infrastructure. Internet connectivity isn't the same everywhere. Power reliability can be an issue. So systems need to work well even with low bandwidth or spotty connections.
Need to be robust.
And digital literacy varies too, right, amongst staff and patients. So interfaces have to be super user-friendly, and you need good training.
And cost. I assume that's a factor.
Cost is always a factor, yes. And then there's the technical challenge of just integrating these new AI systems with the existing hospital IT systems, which are often older and maybe don't talk to each other easily.
Yeah, that integration piece sounds tricky. It's not just plug and play.
Not usually, no.
Did the sources give any examples of how this might be adapted, maybe for situations outside big, well-equipped hospitals?
Yes, actually, there was a really compelling example focusing on ASHA workers in rural India.
Ah, the community health workers. Right.
Exactly. They're often the first point of healthcare contact in villages. The sources suggested equipping them with its simplified AI triage tool, maybe just on a basic mobile app.
Okay, how would that work?
Well, the app could guide the ASHA worker through collecting key vital signs, asking specific symptom questions. The AI backend then analyzes that info, generates a risk score, and gives a clear recommendation, like maybe advice for home management or, crucially, flagging the need for immediate transport to a hospital.
Wow. That really shows how you could tailor the tech, leverage the people already on the ground.
Exactly. It highlights how AI isn't a one-size-fits-all thing. It can be adapted to specific needs and existing healthcare structures.
That example really shifts the focus, doesn't it? It shows AI extending that expert assessment capability way beyond the hospital walls.
Precisely. And I think that leads to the bigger picture here, which the sources emphasize. This isn't about AI replacing nurses or doctors, replacing that human touch, that empathy.
Right, it's a tool.
It's a tool, an intelligent assistant, really, designed to help healthcare professionals make faster, more objective, more accurate decisions right at the start.
So they can ensure the people who urgently need care get it without getting lost in the shuffle.
Exactly. It's about optimizing that crucial first contact, improving patient flow, using resources better, ultimately aiming for better outcomes for everyone.
It paints a picture of a future where that first step into healthcare, that triage moment, is just faster, more consistent, maybe more equitable too, no matter where you are.
A future where technology is really empowering those frontline heroes, making those critical seconds count even more.
So think about all this from the sources. What does it really mean for you, the listener, as a patient? What are the implications for healthcare access, for equity, when technology can push that expert assessment, that initial guidance, potentially far beyond the traditional clinic or hospital?